For you, I want you to win a Padma Bhushan. That is the gold standard. What you are doing in terms of impacting the lives of billions of people in India. As a country, we need entrepreneurs like you.
Triggered so many thoughts that if this is the situation in a place like Gurgaon, which has such amazing healthcare infrastructure, I have such a strong personal network, I'm going through this, what's happening to the rest of the country? This is a problem with the might of the government in terms of money and reach, they have not been able to solve.
He said, "Aap Bhubaneswar aao. So if you don't come to Bhubaneswar, I will not let you invest."
That if you not offer them the right price, the right value, you're putting a question mark on your quality of service. This was the first time I saw an investor coming and not just saying, when is the morning flight, when is the evening flight. They said, we're going to stay here for a couple of days. And we went into very deep discussions which I had not had before. That's why I thought Bertelsmann was an amazing partner in terms of, because if somehow if the DNAs don't match, if you don't think through, I think the journeys are going to be difficult. And recently, I think there was some media interaction that was happening and they told me how many co-founders you have. I said, rough guess 150. It's disruption in some way.
It is.
I think it's a slow revolution, disruption which is happening at the grassroots.
Building on that, Pankaj and Swati from BII sit down with Priyadarshi in this episode to unpack how his mission is taking shape and what it signals for the future of rural healthcare.
How do you start the CureBay is the question. The story.
So the story of CureBay actually started when I was with Google in Gurgaon, and this was the peak of the pandemic. I had a bit of a health issue, and this was the time when even domestic help, security guard, nobody was coming home, and I was wondering what to do. I called the Google helpline. I said, I need help. They said, don't worry, a leading private hospital will call you, and everything is set up for you at 3. I think around 2:30, I got a call asking me for my Skype ID. And Pankaj, I burst out laughing. I said, this was a product my team used to sell. I don't have a Skype ID. So I don't know who in today's day and age is using a Skype ID, but that triggered so many thoughts that if this is the situation in a place like Gurgaon, which has such amazing healthcare infrastructure, I have such a strong personal network. I'm going through this. What's happening to the rest of the country? And that's when the thesis of CureBay started. And my thesis was based on the fact that as you go deeper and deeper, there are about 1 billion people living in this country who are all dependent on public healthcare infrastructure for their basic needs, and the journey is completely broken. Up PHC mein jao, you don't find people, then you go to a pharmacy store. That pharmacy is not even run by a pharmacist. A local trader, he's got some money and he's behaving like a doctor doling out medicine. So something had to be done about it. Somebody had to solve for it, and CureBay was born as a hybrid model. And the premise on which we built CureBay was, how do you bring full stack healthcare? You're not just making a tick mark exercise. I wanted to bring equity into healthcare. So what an urban patient would get, how do I deliver the same experience to a rural patient? Entire healthcare journey, but in a manner which is high quality and affordable. That's how the journey starts.
Wow, what an inspirational topic. I mean, we have been kind of thinking about how to solve problems, very, very difficult, complex problems, especially in, let's say, rural India, where access to healthcare is not there, access to most of the things is not there. You have taken an extremely complex problem, which is already healthcare, and then overlapped it with rural India. That would have been very, very difficult. I mean, was that an easy decision for you? Was that a very difficult decision for you? What was going in your mind?
No, honest answer, Pankaj, is when I started, it was more romancing the idea. But when I got into the ground, what you said is exactly the reflection I had. This is a problem with the might of the government in terms of money and reach, they have not been able to solve. No new age startup, private player has made a foray because they know how difficult the problem is. And here in Orissa, which is one of the most difficult places because really healthcare challenge was there, I'm trying to solve it. So The realization actually dawned to me when I decided to start the project. Otherwise, probably I would have backed out. But by then, I was so committed to the idea and I was so moved. And I'll probably share a small anecdote with you what moved me. When I was literally thinking through this idea, building my thesis, I actually came to Bhubaneswar. And my mom is a doctor. She started the first private nursing home, and I came down to discuss with her the idea. I saw a lot of people standing outside her clinic. My mom's, and it's a age-old clinic. I thought her patient. So I told her, I said, "इतने लोग क्यों हैं? Have you converted into a COVID center or something?" तो मैं जाके I'll talk to some of my friends who are in the bureaucracy because she's in an age where I didn't want her to be exposed to this. She said, नहीं नहीं ये मेरे regular patients हैं. I said, why have they come here? अभी तो travel restrictions है. So why don't you go and speak to them? So when I spoke to some of them were actually nothing to do with COVID, regular patients, and they have risked, literally risked their lives to come and meet the doctor there. I said, क्यों कर रहे हो? Well, we don't have anything there. And then there was a very restricted time for travel those days. Only a couple of hours you could travel. So I went. I said, I want to see. The sight I saw in front of some of the PHCs and all was pretty moving. I saw that if somebody was diagnosed as or identified as COVID positive, uh, they were just dumped outside the PHCs because the whole village ostracized you, right? And there was nobody to attend to you. And these were things which are extremely moving. I said, somebody has to do something about it. And I said, I want to do it. I want to do it. I want to try my hand. And I think there is a way to solve it because nobody has really thought of how to leverage technology to solve this. There is a way. And just jumped into it. And like I said, after I jumped into it, I realized what you just said. It was a tough problem. It was a tough problem.
You know, we have been evaluating or looking out for similar models, although we did not know what that model would be. But we also knew that it was a very, very hard problem to solve. And over the last 7 to 10 years, we have looked at a lot of health tech companies. Somebody would be a diagnostic company, somebody would be a pharmacy company, somebody would be a teleconsult platform. And whenever we would think that they would go into rural India's, we believe that that entire experience would be broken. Um, and honestly, we did not know what that answer was, but we knew that that was not the answer. And I think when Swati and I met you and we heard how you were solving it was like a eureka moment, honestly, for us. That this is the way that that the problem needs to be solved. If you're not taking an ecosystem approach, if you're not solving each and every part of that equation, then it will fail. So I think it was a very, very fascinating meeting, understanding what you are doing, the complexities that you are dealing with, and building a
I think I recollect when I first met Priyo, he said, "Aap Bhubaneswar आओ." So if you don't come to Bhubaneswar, I will not let you invest. पहले Bhubaneswar आओ. Which changed our one, that was your ask from the investor, and then we also saw that you are solving the problem sitting there. You're not some founder sitting in a tier one urban company and instructing your team ki ye kar do, wo kar do. You're in the middle of the problem, solving it, getting your hands dirty, and which is what we like. We realize that if something like this has to work, scale, replicate in other states, cities, the founder has to be on the ground. That was one which was really, really exciting about you. And then when we came to those clinics, it was an eye opener. The experience is so good, and the kind of team you've built. Every element of the team, from the cluster heads to the ops head, they are so driven, and bringing them all together in villages to work for them. I think it needs a very, very high agency team. It's really, really amazing how you've built that team. I feel that's your big secret sauce.
Yeah, totally, totally. I just to sort of add on to what you said, Swati. I mean, I was very clear from day one. Just because you're solving for rural healthcare doesn't mean you give them something which is suboptimal. In fact, when we sat down to solve this, when we were sort of sketching it out in the whiteboard, I said the quality of service that I want to deliver to them is probably better than what an urban patient would get. And today, when I look at it, the way we are solving some of the things, like you said, I said, this is not a transactional business. In fact, a lot of people advise me, why don't you just do one line? right? They don't have access to diagnostics. Solve for it. You will stay focused. You will get less capital. Somebody told me, why don't you just help in the pharmacy supply chain, right? And I realized you are solving for a healthcare journey. You're not solving for a business or a revenue here. And if you want to solve for healthcare journey, you need to bring all the elements. Why should that guy not have the same experience you and I would get when we walk into an urban polyclinic? Yeah. And the parts which are missing, I think technology can solve. Today, I mean, the real story, if you walk into a CureBay clinic in a rural India, you will meet the doctor immediately. You will consult with the doctor immediately, which probably will not happen if you and I go. We'll have some waiting time. Most importantly, the doctor will advise you probably some tests and all, and you usually have a follow-up call. What do? We walk out, कल जाएंगे, परसों जाएंगे, टेस्ट कराते हैं, फिर जाते हैं. We tell our people, wait here. I'll get the test done. In 10 minutes, the report will be here. The doctor will see the report live, and your follow-up call will happen now. That's an experience which I think is better than even what an urban patient would get.
Yeah, we don't have that experience here. Well, that's very, very powerful.
And this has been possible, Swati, because of the point you alluded. I think truly the secret sauce in the model is not the technology, not the business model, not how we went about it. I think it's getting a set of absolutely passionate individuals who sort of associated very strongly with the purpose. You know, Pankaj, when I started, I didn't have money. I mean, initially, few months I was bootstrapped, no funding, and I was just putting in my own money. I met folks who I just couldn't afford, but they were extremely passionate about the purpose. So the only thing I did is I told them, come down and see what I'm doing. I think my strike rate was almost 70%. People said, that's okay. I have had leadership members who worked with me, no equity, no salary for close to a year. Just a leap of faith in what we were trying to solve. And that truly is something that's the glue which held all of us together, most of us together.
You are serving a market where people don't dare to go. We've seen other models, but we've seen very broken pieces of servicing. It's not full stack. It's not the longitudinal health that a company is capturing for the patient, which means they're not able to service them full stack, which is what is differentiating for us. So it's not just impact that we're creating, and we're also creating good business for
Absolutely.
ourselves.
Totally. And that's a belief with which we started, right? We said this model is going to be based on dignity of care. I'm not going to offer free services. I'm not going to build a model on CSR or grant because we all sort of took it for granted that the rural patient will not pay. That was such a massive urban myth. Yeah. You give them the right service, they're willing to pay. So I was pretty sure that you bring right quality healthcare to them. They should see value in what you're doing. They're willing to pay. And then you'll be able to create a business which is replicable and sustainable. Otherwise, you're at the mercy of somebody giving you some funds for some time, and to me, they're humoring you to try something because it's a tick mark exercise. That wasn't our thought, and I think that's worked very well for us till date. Not a single customer of ours or a patient of ours has complained about pricing, which is surprising.
I never expected that.
Nobody has. They have challenges on the service. They demand more. They're very demanding. But nobody has complained about pricing.
I mean, we are not obviously putting very high, extraordinary kind of pricing. It's all market driven.
It is actually
but
lower than market.
It's lower than market, but
Yes.
it's not heavily discounted,
It's
but
not
it's not premium. It's
Absolutely.
the right level of pricing.
It is the right level of pricing, and they see value in it. And I realized also that in healthcare, price is not very elastic. In fact, my learning was initially when I started, I went to a village. I asked them, I said, this is what I'm going to do. So I spoke to the sarpanch, he arranged a few people. I was just, what do you call it, trying an MVP or something, right? Yeah. I don't even know the term. And I was speaking to them that, aise hi hoga. This will be a laptop, doctor will be there, our people will be there to assist you and all. बहुत बढ़िया है, this is great. So I said, you will pay? हाँ हाँ. बोला कितना दोगे? बोला आप बताइए. बोला how much do you pay today? No, that guy is not even a doctor. He's there, we go, we gives us medicine. So I said, 50-60 रुपया कुछ ले लेता है. So I said, उतना मेरे को दे दो. They started laughing. They said, फिर आपका भी डॉक्टर नहीं है. And that hit me.
Good.
That moment it hit me.
Yeah.
That if you not offer them the right price, the right value, you're putting a question mark on your quality of service. Yeah. So I think we got that sweet spot in terms of what is right for them, and they see value in it, and they're saying that, okay, this is great. And when they're paying from the pocket, they're availing the service. It's not like a free camp. They've gone, had the breakfast, got the medicine, thrown it, and come back.
Has a lot of startups tried to go into rural India and damage the reputation of what tech companies or startups can do? And did you have to navigate any of that when you were building it?
Yeah, absolutely. In fact, my initial days when I went and I started the outreach activities, I started going into the villages in our catchment. I was wondering, I said, they have such a massive challenge to access to healthcare. Here is a world-class clinic I've opened. Why don't I have a queue outside? I mean, logically it should be, there is no queue. So I went and started talking to people and they told me, I mean, literally the word they used, I'll translate it, they told me, Nuria, is urban experiments are tired ho gaya. They believe a lot of people come, do experiments and go away. And then they said, a lot of the healthcare people also come. वो कैंप करते हैं, डॉक्टर्स भी आते हैं, हम जाते हैं, we have our breakfast, we come back. Because when I need them, they're not there. They have come with their own purpose. And to deal with that, we said, first and foremost, to build trust, you got to be giving them a sense of being there when they need you, that permanency. So the CureBay clinic, the fact that we have a physical clinic and the fact that that person knows, if not today, tomorrow when I need something, there is somebody to go to, worked in our favor. But initially there was a lot of hesitation, and I think two things worked for me in building the trust. One was this clinic that we put up there. Second, we actually got people from the community. We call them Swasthimitras, and we trained them and we associated them with the purpose. Again, they sort of linked very well with the purpose. And these were not people with healthcare background. Very interesting. When you come, you'll meet some of them. Some of them are school teachers. They're still teaching in the school. Some of them are retired government servant. Some of them are NGOs. They've been associated with NGOs. And these people became our Swasthimitras, and we powered them with a tech platform. And that was our differentiator. Now they could extend a lot of services to the doorstep of people. So people saw somebody they could trust, coming and telling them, hey, by the way, there's an institutional backup I have, which is permanent in nature. And that worked. And that worked, that these guys are here for me. They're here for good. They're here for a long term. They're not just doing an experiment and going with me. But initial days, yes, we were seen as another urban experiment.
This is required for continuity of care, right?
Okay.
If you have some camps or some doctors visiting, they'll check you once, but what happens next? Because there are follow-ups required. Is that problem solved? Do I need to do more? Are there co-issues that exist? So somebody needs to take that longitudinal approach to solving for healthcare, which doesn't come without having something permanent.
Okay. And that's one of the key metrics by which we measure ourselves, continuity of care, right? If I'm not able to deliver a health outcome for the person, I've solved for a particular need that he had at a particular point of time, right? And initially rural, I mean, not initially, even now if you see the behavior of how they seek healthcare in rural India is very transactional. When the condition is acute or chronic, they come. Because we are privileged. You and I are privileged. We have a health issue. Our family, our friends, peer group will tell us health first priority. Take a break. Go meet the doctor. For them, the first thought that comes to their mind is, I'm going to trade off in a day of income. Is this something I can procrastinate? Delay by a day. And when the condition is acute, they will probably come to you.
How did you meet Bertelsmann? What were your first few interactions?
So, Pankaj, honestly, I think I had a very initial discussion with Bertelsmann about a year back, even before this engagement. And I think I'd met Raghav at that time and we had a conversation. He said, this is a great model, but you guys are just too new. I said, yeah, this is something we are trying out. Even I don't know how this will pan out. And I told them I'll come back. I'll come back when I think I'm ready. And this time when I approached Bertelsmann, and for me, there was a thesis of who I want as a partner in this journey. And my thesis revolved around two things. I said, I just don't need capital. I need aligned capital, which for me meant somebody who understands what I'm doing. Second, is patient and is willing to play a long-term game with me, right? And I think those are two very, very strong points which resonated with Bertelsmann, because my first conversation was, I want you to come and see what I'm building. Hearing the story is great, but and the instant response was, yes, we're coming down. When? And this was the first time I saw an investor coming and not just saying, when is the morning flight, when is the evening flight. They said, we're going to stay here for a couple of days. And we went into very deep discussions which I had not had before. And we had our own point of views. In fact, we started with a lot of arguments, but that sort of got me thinking, here is somebody who's thinking along with me. And to be very honest, because I insisted that anybody who invests in CureBay has to come and see, some people came from the airport till the clinic, they didn't step out of their car.
Oh, wow.
They were on the phone. And then they went back and they said, great model. I said, thank you so much. I mean, to me, it appeared as if it was a waste of, somebody even traveling that long. And here we were having detailed conversations. We were, challenging each other on the ideas and the
I
model.
didn't even let Priyo select the clinics. I said, I'll decide.
So take me on the way, I'll decide. Give me a map.
Wow.
I said, this is great because this is what I do with my team.
हाँ,
Right?
wow.
I said, मैं नहीं बताऊंगा.
हाँ.
मेरे को डायरेक्शन में लेके जाओ, मैं बताऊंगा कौन सा क्लिनिक जाना. And this is what was happening to me. And then we had discussion, deep discussion. That was one part. Second, I remember the conversation I had with you, Pankaj, and I still remember you told me, Priyo, there's a certain, and both of us were not aligned on a particular point of view, and you said there is a reason you have to think through why I'm telling you something, because I've seen this long time. You got to make some corrections to your model. You've built a great business, but there are inefficiencies which you need to correct, and you need time. For the first time, I heard somebody telling me that, listen, you need time. Not once I get the money, how fast are you going to grow? And that gave me the confidence this is for long term. This is about co-thinking, co-building the business. This is not about, listen, I've come in, I put in some money, tell me what is happening. And those two things
I remember that
resonated.
conversation.
Those two things resonated so well with me. I still remember, I just kept the phone and I kept thinking about it. I said, this makes sense. I was not thinking. In fact, that thought triggered in my mind. I wasn't thinking like this. And I need to do this if it's a long-term sustainable business. And I think that's why I thought Bertelsmann was an amazing partner in terms of, because if somehow you don't, if the DNAs don't match, if you don't think through, I think the journeys are going to be difficult. And I'll be very honest, the reason I was insisting people to come down and see the business, I said, at this stage of my life, I don't want to answer funny questions in the board meeting. Yeah, and if you don't see what I'm building, very difficult to relate.
No, that's, you actually kind of pointed it out very well. A lot of times internally we debate about this whole concept, which, let's say, the Silicon Valley funds talk about being founder first. And internally we say, listen, we don't want to be founder first. We want to be founder fair, which fundamentally means that we're going to make sure that we put our founders ahead of us, definitely, but we're going to have honest conversations. And as part of those honest conversations, and of course, we'll have it in smaller rooms, we'll not have it in a board meeting, etc., etc. But if we have a differing point of view, we'll politely put that across and let the founder think about it. And if he or she still believes in it, then please pursue it. If he or she doesn't believe in it, then we'll stand corrected, and we will then refine our thesis alongside. And honestly, something that you are saying, that we did that with you. Some of our other founders have told us that over a 7-8 year journey, all of us have grown together. All of us have learned from each other, and that is a journey that they have cherished a lot, and we have cherished a lot. And from that perspective, look, we are super excited to have partnered you. It is for the long run, absolutely for the long run, and I do hope that we are able to build fantastic business together. I must say that a lot of times I tell entrepreneurs that you have to build a very successful business. For you, I'm not going to say that. For you, I want you to win a Padma Bhushan. That is the gold standard. What you are doing in terms of impacting the lives of billions of people in India. As a country, we need entrepreneurs like you. And if you solve what you're aiming to solve, you will not just have a very successful business, you will be one of the very few individuals in India who would have built and changed lives of so many people. So this is something that we are willing to back and push you towards.
Thank you for that
And
confidence.
I was telling Priyo, unless a political party rams you up first, because you're doing so much of impact on ground. Because he's that way so well known in those clinics, and he does these visits, and CureBay is now a brand. It's not just, it stands for quality. People know that if they see a CureBay clinic, these are my issues, it'll get solved. I can come anytime. And people go over and beyond. I remember one of those team members I met told us about, here was a patient, bilkul middle of the night, they needed something done. Clinics were shut, but he personally went to the house, got that treatment done, took them to, and paid it out of his own pockets. Like, baad mein dekhenge. Let's just serve the patient, the customer first.
And the best part was, Swati, we had a review meeting the next day. And it was my review. This guy is missing. So I didn't know about this story. I came to know. So I said, why is he? He's not there. Then later I came to know that middle of the night he has gone, picked up, put in his car. The patient got to a hospital. Then I called him. I said, why didn't you call us? All of us are there to help. He said, you told me patient first. This is what we. I mean, are we walking the talk? I said, of course we are walking the talk. What you did was bang on. All I'm telling you is there could have been more people from the organization helping you. But and this honestly, like you said in the beginning, this is my secret sauce. The team members recently, I think there was some media interaction that was happening, and they told me how many co-founders you have. I said, rough guess 150. I
Did you
don't
count
think
us?
I don't think I discriminate because co-founder is not a title. It is your ownership and accountability of the business, and I see that in 150 plus people. That's how they behave.
I'm gonna remember that. That's an outstanding way of thinking about it.
We've already served more than 6 million patients, yet maintaining that quality. How do we do it?
So there were some non-negotiables at CureBay when we started the model, and I think there were, if I can sort of share two or three. One was first day experience. I said, come what may, like people see our clinic and experience our clinic on day one, that's exactly how they should experience it 2 years down the line. Because I came from a retail background and I've seen that, fancy retail stores you do, and over a period of time, it's just that attention to details that things go. You're in healthcare, you come and you see something broken, it'll create dissonance in your mind. Subliminally, it'll trigger something. So I said the quality of what we deliver is not just the conversation, the empathy that you're showing with the patient, but the environment which you're showing that. So you got to maintain that. So that became sort of like our DNA, the first day experience. And not that we have, I would rate ourselves still a long way to go in that, but there is a constant intentional drive towards that, that this is what we want to achieve. This is a benchmark here. The second thing is technology. I think the way we leverage technology to capture data points, which helps us in self-calibrating what kind of quality of service we are delivering, is also, I would say, our compass, our navigator in terms of where we are headed. That the signals we pick up from our data, from our technology platform, and enable then what is the execution element that needs to go to fix it. And this is a constant process, constant endeavor, and I think throughout the life of CureBay, this is going to stay.
I'm just thinking about the how the customers or patients perceive it from a spectrum of there is nothing for us. We have to travel kilometers to a city or a larger geography to get ourselves treated, to now such a world class outfit right at our almost at our doorsteps. It must be very, very transformational for even for them to imagine something like this could happen to them.
Yeah, absolutely. I mean, I'll narrate this story to you. So there is this unwritten rule in CureBay that we are in healthcare. There is nothing called free service here, but every person, including a clinic staff, is empowered. If somebody needs healthcare, they can't go away because they can't pay it. Figure out, you are empowered, take a call, and if finance asks you, why did you do this? Tell them, we have this approval from Trio. Okay. So one day I was in a clinic visit. I was standing outside and talking to my team members. I saw this man walking into the clinic. We call it the gamcha in Orissa. He's hanging a gamcha on the shoulder. Unknowingly or knowingly, I just gestured to my team that take care, because I thought this guy can't afford. This guy can't afford. He's walking in. And I saw that guy going to the reception talking. They took him to a doctor cabin, whatever consultation. He came out, he came straight and started touching my feet. I stopped him. I said, maybe he thinks I'm a doctor. I said, no, no. In Odia, I told him, uncle, I'm not a doctor. I'm just like them. He says, no, son, I know you're not a doctor. They told me you're the one who started this. And he had tears in his eyes. He said, nobody has talked to me so well. Wow. He says, I go to that government clinic, they shoo me away. They don't even hear. First of all, that guy is not a doctor, so they are smart. They know he's not a doctor. And that guy is shooing me away, not even listening to me. Okay. Here, I was told the doctor I was speaking to is somebody from Cuttack Medical College, which in Orissa is. And he spoke to me for 10 minutes. Your staff came and gave me medicines, water, and that was a moment of truth for me. The difference you're making to their life is not just treating them with medicines or treating them with a diagnostic care. You are treating them halfway through that empathetic approach. And that is so important in healthcare. And sometimes, we just get a blind spot around that, saying, do I have this certification? Do I have this equipment? The moment of truth is how you're treating that person. Imagine this person's plight. If he didn't go there, he wanted a real service, he would have had to travel to a doctor nearby. It would have costed him a round trip in an auto. He would have spent the whole day. He'd had to fend for his food, wait, come back. 1 day of income gone. Here he came. In 10 to 15 minutes, he's met the doctor, got his medicine, back to his life. Maybe spent about 100, 200 rupees. It's disruption in some way.
It
I
is.
think it's a slow revolution, disruption which is happening at the grassroots.
It's a revolution. It's not just a disruption, it's much bigger than that. It's a movement that you have kind of started, and we do hope that this becomes big, not just for the business side, but I'm sure you'll have not just a few of these stories, but you'll have millions of these stories, if not a billion of these stories, and that's extremely powerful.
I still remember that conversation with Pankaj where an element of my business probably had not stuck to me. See, when you're an entrepreneur, you do a lot of things from your heart, right? You're just in love with what you're doing. And I was in love with what I was doing, growing the business, acquiring customers, building these clinics, and every day was a sense of fulfillment. There's something I didn't focus so much on, and we had a conversation, and he told me, it is not just about building this business. You got to own that customer and engage with him, and your channel and ecosystem, everybody will follow. I have actually taken that, and that had some implications in terms of the financials on how I was doing that business. And I thought about it. And we are now doing something about it, which I don't think is a massive change in the business, but a change in orientation and focus, which I think fundamentally will change this business. And while we continue to impact billions of lives, we'll continue to impact billions of dollars.
That's very, very inspirational, and I think we learn from you. You know, all our founders, if you were to ask us, I mean, as investors, we are sitting fairly far away. Yes, we have the luxury of probably evaluating thousands of businesses every year, getting to know what is working, what is not working from them. But at the end of the day, the detailed view of what needs to be built, how it needs to be built, comes from you as founders. And honestly, it looks pretty easy sitting where I'm sitting saying, oh, please build a ecosystem approach. How difficult it is to build that approach and tie all these nodes together. And while there is an industrial reason to kind of tie these nodes together, do they culturally even come together or not? Honestly, we are not the right judges for that. And I'll be very honest in this podcast that yes, all of those advice can come in because we think logically it makes sense. But on the ground, will it ever work or not? We don't know. So while I'm very pleased that some of the things that we said, you saw value in them and you're following them. Please don't follow everything that we say,
No,
because
no,
because while we're trying to give as much value add as possible, please take it with a pinch of salt that we as investors don't know everything. As you, we are also learning and kind of building our views on some of these topics. And as a collaboration, then what you and I or we can do together is more important than what individual people and how they think.
totally. I think in a way, the way I see it is we're co-building. And one partner in this co-build is so much into the business, right? With heart, mind, and soul that you develop blind spots, right? And there's another partner who's getting a ringside view. So they're able to get a perspective and point out those blind spots to you. And that itself is phenomenal value, right? And you know that you can solve the blind spot. Not exactly the manner somebody has told you, but there might be another way of solving it, which is appreciating the local challenges, local cultural elements and all. But the objective is met, then everybody is a winner.
So, firstly, I want to talk about the Prio. We boast ourselves to be very, very affordable. I mean, quality, access, affordability is what we stand for. How are we truly building that, bringing in that affordability? Because, the myth is that rural people don't pay. There is, you can't have margins. Can you even serve them? Can you even do that at scale? But yet, with all these challenges, we are truly affordable and we have great margins. How are we doing that?
Yeah. So, Swati, our approach to building affordable healthcare was actually a multi-pronged approach. See, the straight and simplest ways, you're in platform, you will bring services at scale. So there's an economy of scale by which, without compromising the quality, you bring down the price. To me, it is a no-brainer. It's hygiene. Anybody can do it. But we interestingly created two other plays, which I think really makes us the affordable quality healthcare player. The first one was rural patients actually suffer a lot because of out-of-pocket expenses. You know, India, we still are like a welfare state, and healthcare is a state subject. And government tries to build a lot of schemes and give a lot of benefits, but most of these are very tertiary related. Nobody wakes up in the morning and says, I want to go for an operation. You have a look at the consumer, the way the journey happens, right? A patient experiences a discomfort. You meet a physician. A physician will do a prognosis. They'll ask you to probably get some tests and have some medicines. Surgery is always the last part of a healthcare journey, right? Now you might be covered for that last part because government has some schemes. You've gone out of pocket in all the other parts. So CureBay created a very interesting program. It was a subscription program by which people took membership at CureBay and they got a lot of these services at very, very affordable prices. We price it like $1 a day, right? And a lot of these out-of-pocket expenses are taken, including when they go for surgery, the loss of income, the travel expenses, a person accompanying them from the family, their expenses. Okay, that was the second play other than the hygiene play. And the third one was we looked at continuity of care. We built a platform where longitudinal healthcare data could be taken. So you're actually nudging the patient on a preventive journey. This has not even happened in urban. We're slowly and slowly trying through this subscription program. And when you do that, you're actually attending to some of these health conditions much earlier and hence saving the money when it becomes critical. So that's a long-term play in how you're making it affordable. The short-term play in how you're making it affordable is the quality of the services you're bringing them at a certain price and ensuring that they don't go out of pocket, which is a big problem in rural India.
And we are able to do that because of the ecosystem approach by partnership with the right players.
Absolutely. Absolutely. It's something that we got the ecosystem, we got our technology play, and we got the customer to see the benefits it in a manner, and we made it like a bite size for them, right? If you tell them then you know all this is coming at a huge sort of amount of money upfront, they'll be probably hesitant. You made it bite size for them, you got them the benefits, and you attack the real problem. The real problem is not just giving them something when they go for the surgery. What has happened in between? They will not go alone. There's somebody going to accompany them. Who's going to pay for that guy's expenses, travel? These are real costs. So you got to have a program which takes care of all this, and that's what CureBay did.
Makes sense. So one of the things that you said early on in the podcast was you are not giving a substandard service to the consumer just because they're sitting in rural. And from all our board conversation and other conversations, I know that you're very passionate about data and how you are building the next frontier of healthcare for rural India. Doesn't really matter whether they're rural India or urban India, but what you're building as an architecture is probably what we don't even see in urban India. Can you elaborate a little bit on that and what you're doing there?
So when we started this model, and when you look at primary healthcare, the canvas is just too broad. And if you want to meaningfully solve for it, you need to stay focused. So the first question we asked ourselves is how are you going to stay focused? We don't even know. I mean, coastal tourism is skin is an issue, centralism is sickle cell anemia. How do you? So data is the solution. As we're solving for access to healthcare, we started building for one of the largest platform for compliant healthcare data. There were no doctors in India. When there are no, I mean, there's a shortage of doctors. Imagine data. There was no data. Specifically in rural primary healthcare, there was nothing available, right? So we started building a platform. When we started building this data platform, we realized our ability to now do cohort analysis and figure out what are the interventions which are required in particular market makes us very sharp focused. So our ability to make the most of the resources we had sort of became very sharp focused. That was one. Second, we started, because of the ability of data, we started creating interesting AI models. And I'm a big believer that if you have to solve for this, AI is going to be an enabler. AI will never replace a doctor, but AI is going to be an enabler. And I'll give you an example. We have created a very interesting model for dental. And rural India, is notorious for chewing all kind of stuff, right? Today, my Swasthyamitras go and just take 2 or 3 photographs and instantly give me a report saying, hey, ye aapka condition hai, no? You're looking at a high risk here.
Say
Okay.
they have a phone or
Yeah,
a tablet with
उनका
them.
WhatsApp में चला,
Oh,
उनके
WhatsApp.
फोन में उठा के वो दूसरे कस्टमर के WhatsApp में भेज देते हैं, कस्टमाइज्ड रिपोर्ट सेइंग ये आपका है. एंड बाय द वे, आपको घबराने का जरूरत नहीं, ये बगल में क्योरबे क्लिनिक है, यहाँ पे जाइए, वहाँ डॉक्टर आपको बताएगा. सो वी नेवर रिप्लेस अ डॉक्टर. We use this as an engagement methodology. Okay. Now look at the beauty that's happening here. A lot of people are creating AI models. I know, I came from the world of technology. Banana is not a big deal because most of these cloud providers will give you an API. 90% of that is synthetic data. You cannot use it for prediction in healthcare where you're dealing with somebody's life. We, through our network of clinics and people on the ground, are training our models with real healthcare data in the most compliant manner. So my ability a couple of years down the line to make predictive based on my data models and really actually solving for some of the issues will be significantly ahead of what is happening in the market.
They're already able to predict, for example, which part of the town is now resistant to, let's say, a certain antibiotic.
Oh, really? Wow.
Because the amount of data they've collected, the amount of medicines which are, which were working or are not working, etc., is again because of the sheer effort of the amount of lives they've touched. So this is
And these
already
are things you
happening.
can't solve overnight, right? You first and foremost, you don't see today even hospitals don't have a compliant data platform. They might have massive data. Have you taken the patient's consent? Who's allowed you to use that data? You can't have PIIs, right? So it is not just about collecting data. And my co-founder happened to be from the world of data. He was from Nielsen. So we knew from day one what is the right thing to do. And that sort of has helped us.
And it's a delight to go to their board meetings because you get to field visit. It's so wonderful out there to see the kind of lives they are touching. And in that, when you do those field visits, you realize it's not an ops company. It's truly a tech company which has ops. So,
Which is very counterintuitive if you think
yes,
from outside.
yes. So each piece, like there are many, many nodes in the business. There are people who are trying to facilitate the consultation with the doctor, trying to the connector to the pharmacy who will deliver or they will themselves deliver, the partnership with the diagnostic centers or their own diagnostic centers, and the runners in between who will also go to people's houses if required for diagnostics or for consultations. Many, many nodes connected together and everything happening real time seamlessly with real product feedback loops.
And in fact, we call ourselves a tech company. And I remember, one of the recommendations that was given to me, you're solving for rural healthcare. You could be far more profitable. आप tech पे बहुत ज़्यादा invest करो. I said, no, I'm not investing. Tech is my leverage. Tech is my foundation. You're not seeing it today. Couple of years down the line, this is the operating leverage. This is what going to help me scale to across multiple markets. Okay, operations purely is not going to help. Operation is going to be an enabler, is going to be the facilitator execution. But this is my enabler.
What do you think are the next 5-year big challenges and opportunities?
Top of the mind, one of the big opportunity that comes to me is we are going to probably transform rural insurance. People have not been able to make foray into rural insurance because even if you give an insurance product, where does the fulfillment happen? If for the fulfillment of service somebody had to go somewhere, then it defeats the purpose. I think the foundation that we are building stands us in a good state to be probably one of the best partners for an insurance company because you have the service delivery model, you have the data which will help in underwriting what kind of risk, and you have the ability to win the customer's confidence because you're local. So that looks like a very big opportunity for me, and that will also help me in driving customers on a preventive journey. So it ties up with my eventual goal. The second big opportunity I see is probably with government as a partner. And I think if there is a role CureBay can play in facilitating what the government is trying to achieve, then initially I was crawling. As I reach the walk stage, I should be able to walk along with them. These are two sort of big opportunities. Challenge is honestly, Pankaj, what I don't know because it's a regulated field. Healthcare is regulated. There's some regulation change that comes which I'm totally unaware of today. At that moment,
Execution
I have to react.
challenges?
I don't see that as a challenge.
All of that has been now
Yeah,
finished.
I think we've got the playbook ready.
How do you find motivated people in the villages to work with you? Do you think there are plenty of them, or And then is training an issue? Is finding those people an issue? Both?
I think your ability to really find the right talent is the biggest challenge. There are two kinds of team members I have. One is the healthcare worker, the clinical staff that I have. That as a model we have cracked because we've realized there is a lot of government colleges which are there from where there is no placement there, right? You get those people and you upskill them because you train them on a technology
You
platform.
do have to upskill them.
Yeah, we do upskill them because they're not used to technology. They have got a degree in healthcare, and you're creating a career path for them. You're upskilling them on technology and you're creating a career path and you're able to place them closer to the place they came from. So it's a Goldilocks zone which is happening for the healthcare worker, which really works in our favor, right? And that's the playbook we have got. The playbook which is still work in progress, I would say, is the ops team. Because there you go onto the ground, you see people. Till now, we've been very, I would say, been on the side of being able to find the right people. It's worked in our favor, and I just we are mastering the playbook now. We are the initial learnings that we have had in the operation team has actually fine-tuned our training manual now. Now I'm looking at even if I get somebody who's probably not as hands-on in the operation as I'm looking at, is there a way we can train them and get them on the path? That's working out for us. So one, I'll give you a simple anecdote. When we were getting to Jharkhand, we got some really passionate guys, but they were finding themselves a little bit clueless what to do. We told them there is no training program. You come and stay in Orissa for a month. Okay. And we posted them in some clinics. The amount of ideas they came back and told us what can be done differently and how to do it in Jharkhand was amazing. Because they know their market, they saw what CureBay is doing, and they came up with. So I keep telling the team, don't insist on 100% execution of the playbook. We have created a playbook, 70% of that will stay true, 30% has to be the local flavor. Because Bihar healthcare issues, Jharkhand, Chhattisgarh, we might have 60-70% similarity, 30% is going to be very local. And we got to respect that and we got to work accordingly.
That's outstanding.
Let's conclude this episode with a fun rapid fire segment. If you had to pick one factor for building trust in rural healthcare, from speed, affordability, and continuity, what would it be?
Continuity. Because the more permanent you are there, the more longer time you're there, you're automatically building trust.
What's one AI use case you're most excited about right now?
Both skin and dental, how you can do early diagnosis and really make interventions that save people a lot of money and pain going forward.
What do you look for when speaking with a healthcare startup founder?
I would try and look at how deep is the problem that they're trying to solve, and is it, again, do they have sustainable competitive advantage over what is being already solved out there?
In your view, what's BII's biggest strength or superpower?
Look, besides being long-term investors and patient capital, we do want to back founders with whom we have great chemistry, who we can work with very well. We are not looking at a 5-6 year time horizon. We're looking at 10-12 year time horizon, if not longer. And from that perspective, the journey is as important as the result. And I would say having that kind of mindset would be our superpower.
What is the bigger challenge today? Aggregating demand or staffing clinicians?
Demand aggregation, because you're talking about a change of behavior. How people seek healthcare in rural India over the ages has been very different, and you're moving them towards a preventive journey. So that is the bigger challenge.
In your view, what is BII's real edge or superpower?
I think our massive superpower is that we just don't chase returns. We actually believe truly in building the business together.
Which clinic service level agreement, SLA, is non-negotiable for you?
Patient experience.
In what ways does BII plan to collaborate with CureBay?
Look, I think as Bertelsmann, we have healthcare as a key topic globally, where we have invested in more than 70 plus companies. We are now building a large healthcare business and division. So this is something that's core to us, and hopefully have a deeper appreciation and understanding of the business. And I do feel that what CureBay is building is extremely unique. We have not seen that in any part of the world. And we do think that while India is a large market and we'll end up building a large business impacting massive amount of lives in India, this business can also then get transformed to other developing markets around the world, whether it's Africa and other places, and we do have exposure to those markets. So I think sky is the limit as far as CureBay is concerned.
What's one way you think founders underutilize their investors?
We should bring forward the bad news and co-work on solving them rather than only bringing good news.
What's the one thing that makes CureBay stand out?
I do think it's their team. I've never seen such a passionate team, and they're not a small organization, they're huge, and everybody is as passionate.
How would you describe your relationship with CureBay?
I think it was a long courtship period, but Priyo finally agreed, and I'm very happy and excited about it.
What stands out to you when you meet a founder from the healthcare space?
I think specifically in a healthcare startup, of course, we're looking for entrepreneurs who are very corely involved in and believe in the mission. And in healthcare, empathy plays a very big role. So if you, as a founder, need to have massive amount of empathy as you're building your healthcare startup.
Platform or service? Which wins in healthcare?
Yeah, because you're not, platform to me is synonymous with long-term value. Services is probably transaction.
What's a common myth or misconception people have about rural healthcare?
I think Priyo already covered that, but we also discovered it during our diligence. Actually, the top 30% of people that live in rural India have average household incomes which are greater than the average household income of urban India. So I think they have the capacity to pay.
If you could pick one area in rural healthcare that's ripe for innovation, what would it be?
Yeah, I think the thing that probably CureBay did very well was to understand the rural customer very well and put together services and offering at price points that worked for them. I think having that view is very important. Number two, being on the ground, building that service bottoms up is the second most important thing that founders need to do. Sitting far away, superimposing a urban solution to a rural problem will not work.
Which founder trait do you think is most undervalued?
Look, I do think that entrepreneurship is a very, very lonely journey. It's a very difficult journey. And we have to appreciate all the hard work that entrepreneurs are doing, all the uncertainties that they are dealing with. They're trying to solve extremely complex problems almost alone as a small set of people, whether it's a single founder or as co-founders. And for investors to have that viewpoint and build capabilities to solve or support them would be very key.
Share a misconception about rural healthcare.
That rural India doesn't pay.
Is there anything you'd like to say about Bertelsmann?
Amazing partners in this journey, and I believe there is a lot of commonalities in terms of how we are approaching to solve this together. And I really believe that we will all have a great time in trying to solve this, not just in terms of commercially being attractive, but impacting lives.
What's your impression of CureBay so far?
Oh, there's so many things to like about CureBay, but the two big reasons for me are, of course, the mission that they are on and what they're trying to build, and of course, the founder Priyo and the team. No, I think it's amazing, how you're kind of building the business. We know that you and your team are super passionate about building this business, and we are very excited to have kind of partnered you in this journey. And we do think that brick by brick, or as you say, circle by circle, you're gonna build this business, and because of that, you'll impact a lot of lives. And we are super excited about this journey with you, and wishing you and your team the very, very best.
Thank you so much. And I think we will all be very proud of what we're building together, because this is not just a business we're building. I think we're fundamentally changing how healthcare is delivered to 1 billion people in this country.
Yeah, fully
Well, thanks,
agreed.
Priyo.